Ahead and we got another important team here, and we have the COVID-19 response status report. And I believe we've got Kim Sartari, our public health director, and we have Bruce Barton, and is Dr. Leung here, or he's out in the field today, right? Okay.
Not that much, huh? All right, good morning, members of the board. Mr. Van Wagenen, Mr. Priamos, Kim Sartari, Director of Public Health. I'm here with Bruce Barton, Director of Emergency Management, so that we can give you a brief COVID update. Lots of activity in the county, so just want to go through this quickly to make you aware of what we are seeing. If we can go to the next slide, please. Oh, no, I can do it, right, Roy? Okay, thank you. All right, so these data are as of yesterday. Our case rate is currently 103 per 100,000. And just wanted to give the board some context in terms of what we are seeing. So back right after Thanksgiving, November 29th, our case rate was at 14, so we're about 7.5 times higher than we were back then. At our peak during the winter surge, which happened on January 8th, we were at 151.5 cases per 100,000. And the state case rate is at 108.7. So we are about where the state case rate is. I will just mention, we do think this is a fairly large underestimation of the number of cases that are occurring around the county. One, because people don't get tested, or two, because they are using antigen tests that don't always get reported to us. Our positivity is at 24.4%. Again, back on November 29th, we were down to 4.9%, so we're about 5 times higher than we were. At our peak, back in 2021, during the winter surge, we were at 26%, so almost there. And the state positivity is currently around 18.4%. Our 7-day case count is hovering about 17,800. And just for context, again, about 7.5 times higher than what we saw back at the end of November. I do have our numbers for hospitalized here. Bruce is going to get into this in more detail, but suffice it to say that we are higher in our hospitalizations by about 4 times and about twice as high in our ICUs. And then also wanted to point out the fact that our pediatric hospitalizations doubled in December, but we are talking about very small numbers. Vaccination status. So for 65 and older, we are doing very well in our vaccinations. We're at about 82.7% vaccination, and that is with not including the booster dose. 18 and older, we're at 72.8%, and then 5 and older at 65.9%. When we look at who has been boosted, so we're looking at the population 16 and older that are eligible for a booster based on the amount of time since their last vaccine. We are only at about 24.4% of the county. It's really bad when the lights go out and you're talking about data. So we are doing a big push around boosters because we do know, particularly with the Omicron variant, that having that booster dose is very protective and lessens the chance of having severe disease. This is just a graphical representation basically of what I just talked about. On the top graph, you can see the blue line is our hospitalizations, so that number has increased. The gray line are our ICU admits, and that number, while increasing, is increasing at a slower rate. And again, Bruce will talk about that more. Luckily, our death data has not increased the way we have seen our case data increase. We are hopeful that that trend will continue. However, we are still seeing deaths even in those without comorbidities. So there still is the possibility of death by this disease. It can be very serious depending on the individual person. I wanted to briefly just touch on R effective. So this is a measure of how many people get infected from every positive case. So for the state of California, we have about 1.5 people that get infected, or that if you are positive, you spread the disease to about 1.5 people in the state of California. In Riverside County, that number is higher. So if you are positive, you are likely to spread to 2 other individuals, which is why we are seeing such a huge increase in cases. There are a number of reasons for this. It could be related to the industry that we have. We have a lot of hospitality industry, a lot of interaction between people. We also have a high level of under-resourced areas, so people who don't have access to testing and some of the things that we're really working hard to get out to those communities. Next, one of the things we get asked about quite a bit is our who's becoming a case or hospitalized or dying from this disease in terms of vaccination status. And so our team here has looked at that. And so what we know is that if you are vaccinated, you have about a 1 in 100 chance of getting COVID. If you are unvaccinated, you have about a 1 in 4 chance of getting COVID. So when we look at the numbers, and I won't go into the numbers, obviously a lot more people that are cases of COVID in Riverside County or have died from COVID are unvaccinated. So this slide is just looking at our cases and vaccination status, and so you can see as the vaccine gets more rolled out and more people are vaccinated, we expect the proportion of cases that occur in vaccinated individuals to increase because more people are vaccinated. And so we do see that trend. So in December, about 30% of our cases were vaccinated. But again, having a vaccine and getting infected with COVID, particularly the Omicron variant, typically you have a very mild illness as compared to unvaccinated individuals. When I switch over here to looking at deaths, so you can see just the trend is basically that about 90% of individuals who die from this disease are unvaccinated. So again, just points to the importance of getting vaccinated. This graphic shows hospitalizations, and again, Bruce will get more into this, but the main takeaway here is that unvaccinated patients account for about 90% of our hospitalizations in Riverside County, and that's true largely throughout the country. And then just looking at our hospitalizations by age group, so you can see from this graphic that our folks that are over the age of 80 have a higher likelihood of being vaccinated and hospitalized. And so we think that's because immunity does wane more quickly in these individuals and just points to the necessity of getting a booster. All right, and then just a couple more things wanted to point out. So in terms of outbreaks, so we know that Omicron is more transmissible. So just in the last 10 days, we've had 128 outbreaks reported to us in businesses with 3 or more cases defining an outbreak. So we are seeing a lot of outbreaks in there. Our staff are very busy. And we have had 5 outbreaks that would be defined as major under the Cal-OSHA definition, meaning that they have 20 or more cases. In the whole month of December, we had 84 outbreaks reported with 3 or more cases and 14 that met the definition of a major outbreak. Then wanted to touch quickly on schools. I know a lot of folks are a lot of our kiddos are just getting back in school, but just in the first 10 days of January, we have had 20 outbreaks reported. Again, an outbreak being defined as 3 or more cases. And in the month of December, we had 76 outbreaks reported in schools. I would mention just that the schools are a tremendous partner with us. We have great relationships with the districts, with the superintendents, and they work really closely with us on reporting these cases, on hosting testing clinics, hosting vaccination clinics, so really good partnership there. And then lastly, I just wanted to touch on our testing. So I know that there has been a lot of discussion about the demand for testing. As the demand scaled back in the past months, the hours of operation and the number of teams that we had around the county also scaled back. Our testing sites are through contract, so we contract with Curative, and then we also have the benefit of state resources that are under contract with the state of California. Those are LHI and OptumServe. So we currently have 16 fixed sites. The OptumServe sites, they are going to be expanding their capacity by 50%, going to 5 days a week, 12 hours a day. And then we have 10 Curative sites. They're going to be expanding their capacity at 5 of those locations. We have 4 Curative mobile vans and 1 LHI van, or the state van. That's going to be expanding its capacity to 10 hours a day, 7 days a week, so that we can have more testing available in the community. We also are adding 2 fixed locations, one at our public health admin building for employees. So we'll be doing employee testing there, running those specimens through our public health lab, and then also at one of our WIC sites, probably in Hemet. And then we are working with the state to try to add an additional mobile van at this point in time. Our community health centers, the RUHS community health centers, also tremendous partners. They are adding about 100 appointments a day at 4 of their locations, including weekend appointments, so making those available to the community. And then also working with CBOs to stand up their own testing. So like Reach Out, for example, they're gonna be standing up their own testing. So really important partnerships there. And then I wanted to mention turnaround time. So Supervisor Spiegel mentioned the new isolation and quarantine guidelines that give folks the ability to test out of isolation or test out of quarantine. So PCR, we took a look at our data, and so our tests, these aren't all tests done through the public health lab. The majority of them are done through curative labs. But the turnaround time is about 69% of the results come back in 1 day, and about 93% of the results are back within 2 days. So majority of tests, you get your results within 2 days for PCR. Antigen tests, obviously you can get immediate results, but really hard to obtain those kits right now. The federal government has placed an order for $500 million, supposed to be a website up next week, but we don't have any details on that. And then the governor announced in his $2.9 billion pandemic response plan that he also would be purchasing antigen test kits, distributing them to the local health departments for distribution to the community. And then in Riverside County, we also are trying to find them to purchase, but not having any success right now. We do have a cash on hand, but those are prioritized for our healthcare workforce, our first responder workforce, some of our skilled nursing facilities, and some critical county staff, like our social workers that are doing emergency response. So we are continuing to work to try to get more antigen tests available. I know it can be frustrating because if you are in isolation, so you've tested positive, and you want to test out of isolation at 5 days, we recommend that you use an antigen test because a PCR test will likely be positive for up to 90 days. And some people are having trouble with that. So we do have antigen tests that we are trying to make available through our testing locations. But it's going to be a while before the supply chain catches up with demand. So with that, I will turn it over to Bruce.
Thank you, Kim. I think we just have one slide. So good morning, Supervisors, Mr. Van Wagenen, Mr. Priamos. Happy New Year. I'd love to be doing anything but giving this report going into year 3, but as we currently stand today, 901 COVID positive, and this runs 1 day behind. So 901 COVID positive, that's a 77% increase over the last 10 days. Just for reference, last year, January 10th is where we peaked with hospitalizations at 1,671. As of yesterday, we had 139 COVID positive in the ICU. That's about a 48% increase in the last 10 days. And we did also crescendo with ICU COVID positive last year on the 10th of January at 375. Of the folks that are in the ICU, 59% of those patients are on ventilators, and our overall ventilator utilization with the resources that we have on hand is about 33%. So that's good news and very much different from some of the previous surges that we have seen. This surge is a little bit different in nature than the previous surges, in that the previous surges largely spared the EDs. We saw lower ED volumes in previous surges, particularly last winter's surge, compared to the baseline ED volumes we were seeing, and the EDs are just getting hammered right now. So we're seeing very high volumes in the ED. And on top of that, all of these COVID numbers are laying on top of a really larger non-COVID inpatient hospital census. So the hospitals are very busy. Just because the numbers are lower than they were during last winter's surge, that's not necessarily representative of the full impact on our healthcare system and on the hospitals, because they're laying on top of that higher non-COVID patient load that they're all carrying. Overall system capacity, we are at 81% of licensed beds and 91% of licensed ICU beds. Now that's across the system. There are some hospitals, as a matter of fact, there's a number of hospitals that are close or are over, some are well over 100%. All of those facilities have implemented their surge plans. They found additional space, additional staff. Staff remains a challenge, and then of course additional equipment to be able to support patient care as part of those surge planning. As I mentioned, ED call volume, just as for reference, is about 26 to 3,000 a day across the system, and about 28% of that is actually COVID related. For reference, in the 2021 surge, it was about 2,000 to 2,400 per day. So, as I mentioned, a lot of higher ED volume. We are seeing EMS system, some very severe EMS system impacts, particularly when it comes to ambulance offload delays. So that's an issue that will be taken up later on with an agenda item in the board meeting, as well as some staffing issues with the ambulance provider. Skilled nursing facilities are also starting to report that they are having some issues with staffing, and we are continuing to support them to the degree that we can and push those staffing resource requests up to the state of California. The state is also working on doing a build out to be able to have additional surge capability, working with some skilled nursing facilities to place state staff there so they can take, if they have the capacity, to be able to offload from some of the other SNFs that are having more severe staffing problems. As far as our ongoing support efforts, you know that we continue to coordinate all the COVID response activities, the medical and health response activities through the Medical and Health Department Operations Center. It has been that way since April when we stood down the EOC, and that DOC continues to be managing all of our efforts. Additional efforts as far as resource requests to the hospitals, thanks to the support of this board through the CARES funding, some of the other funding streams, as well as some of the mutual aid resources that we have received from the state. We've retained them here in the county in our warehouses. We've actually expanded to multiple warehouses now. So when it comes to stuff like mobile buildings, we've deployed those to the hospitals if they've requested them. These are the buildings that they put outside the ER to help with patient load, as well as surge tents. Ventilator cache, we're only about 33%, as I mentioned, so we have a large cache, as well as still have a large cache of personal protective equipment. Personal protective equipment is holding up pretty well, as well as durable medical equipment in the hospitals, but we do have cache to be able to supplement them if they request it. Once again, as has been in previous cases, the real issue is staff. Several of the hospitals, as a matter of fact, most of the hospitals have put in staffing requests. The state has not fulfilled those staffing requests quite as quickly as they were doing in previous surges, but they are now starting to provide staff, and staff is trickling in based on those resource requests. We are continuing to have coordination calls with all of the hospitals and state partners to make sure that those resource requests are staying high on the priority list, but pretty much every county, this picture I'm painting for you as far as hospitalizations is literally playing out right now in every county in the state of California. So those staffing resources are hard to come by. One thing that is always continuing, and as has been the case, and shout out to our UHS Medical Center, as they have continued to partner with the state. They have done a surge build out there, so they're able to take on additional capacity there and are assisting with offloading and taking in patients from around the region if needed. But they are extremely busy over there. They are holding the highest patient load of any hospital in the county. As a matter of fact, I think Jen told me, I don't know if she's here, but I think there were close to 500 patients in the hospital yesterday. As far as, and I already mentioned the coordination calls. So that's pretty much our report for today, but I'm able to answer any questions that you may have.
Thank you, Bruce. And any questions from the board, any of the three virtually? How about you, Kevin? You know, I'd just like to make one comment and maybe a little bit. We talk about the surges. You know, originally it was going to be we're going to flatten the curve for two weeks or whatever. From my understanding, there's the bad part about the Omicron is it is so contagious. In fact, on the way over to work yesterday and today, it was almost as though a lot of people weren't going to work. So I think it's the first time I've seen social distancing practiced on the freeway. Sometimes it can be a good thing, but the thing that this good part of this is that when you have such a quick surge, it peaks earlier. And so I've heard from some reports and talking to Dr. Leung and such that we may be in the peak right now, but some models are showing it right now and some models are showing it in a week or two. So if we can weather through this, there's going to be a lot of people feeling ill, not coming into work and such. But overall, this one might be one that we can see the light at the end of the tunnel fairly early. And again, thank you for your reports. Thank you for staying on top of stuff. And hopefully especially our people working in the hospitals that have this is going on the third year. We're going to have to really do some recruiting for a lot of, because I know a lot of them are getting just worn out and leaving the profession. So thank you both.
Yeah, our hands are up. Supervisor Perez and my hands are up.
Oh, sorry. Okay, so I'm looking. My deal here is, let's see. Here we go. Okay, so yeah, go ahead, Karen.
Okay, couple of quick questions. Kim, do you see that all the efforts that we put in our seniors, because I'm a senior, I'll put it the higher end of seniors. I know we put a lot of emphasis the last round. Is that showing as a positivity, not in COVID, but in the lack or a lesser amount of our seniors that are getting ill and hospitalized?
Supervisor, that's a great question. So I would say yes overall, with the caveat that all of that effort that was put into getting our senior populations vaccinated and making sure that they were protected and minimizing the number that went to hospitals, that was all done. The big push was over 6 months ago. So now we really need to go back and follow up with the boosters and make sure that those folks are boosted, because we know that immunity has waned in that population and they are more susceptible to getting infected. So double-edged sword, because we made a big push at the beginning and now we are following up and pushing the booster as well.
And my second question is, I don't know if you've had the opportunity to see the news in the last 24 hours. I try and avoid it, but boy, this one caught me. And Dr. Walensky and Fauci have been testifying in one of the committees, and it's been almost appalling to hear some reverse turns on some of their statements. I hope that you keep us up to date, because it's kind of interesting, and I don't know, as I said, if you've had a chance, I think you should, because it's alarming that there is such a big change in some of their direction. So I don't know if that's going to filter down or how that's going to be handled, but they were before one of the committees, and I just hope that we get some answers on that one.
Absolutely. We'll continue to monitor.
Thank you.
Supervisor Perez.
Thank you, Mr. Chair. Thank you, Tim and Bruce, for the presentation. I wanted to ask, I understand that maybe later today, Tim, we're going to send out some sort of document, information for more test sites. Is that what's happening?
Yes, Supervisor, we're going to be sending out just a flyer to make it easy for people to locate test sites, and it will have the expanded hours on it.
Very good. I'd like to honestly make sure that we get that out to the media in hopes that they will print it.
Absolutely.
Or speak to it, if it's radio, TV, what have you. That would be helpful.
Sure.
And because of the surge, I'm wondering if we need to close the chambers. I'm wondering if folks need to rethink here and maybe have people work from home. Just want to get your thought about that.
So, Supervisor, that is a tough one, and ultimately up to the decision of the board. I think it's a balance between being able to provide county services that are critical and keeping folks safe. And I think that as a county, we have implemented a lot of things to keep our staff safe, including making testing available. We have dedicated staff that just work with our county employees that may be either sick or exposed. So there are a lot of things in place, ultimately it's up to the five of you to decide if you want to do more.
Appreciate it. And just on my end, we're working on a skeleton, if you will, staffing where some folks are working from home. You have some folks here in the office, but everyone is definitely distanced and working out of their own office with the door closed. Seems to be working for us very well. Nonetheless, though, people have gotten sick. And so just a thought for my colleagues to consider. And obviously, I'll go with the majority if folks want to make that decision to close down or not. But nonetheless, just wanted to bring it up. Thank you.
Any others? Okay, okay. Thank you so much. Okay, now that brings us
Yeah,
to...
yeah.
Go,
My
I'm
hand's
sorry, I
up.
didn't see that. Okay, go ahead. One more time, Supervisor Spiegel.
Yes, I appreciate what Supervisor Perez has just said, and I think my only challenge with moving forward with that direction is a lot of our businesses are trying to work through this, and I think that we have to support our business whatever it takes, and if we are being, cautious, like we have talked about, and how Kim has said that there has been some steps put in place, the bottom line is we have to live with this little booger. And we're going to have more variants, and we're going to have more of these, hopefully not as bad as this round has been. I mean, I'm affected, so it's not that I'm trying to say it's good or bad, but if we have businesses, like you saw the numbers of large amounts of breakouts, and they're trying to survive, I think we have to show support. We just have to take precautions on ourselves and our employees, and if that's your choice for your office, I'll talk with my staff. I think all of us have that obligation, but I certainly don't want to see the message being sent to this county that we're closing down.
Thank you.